Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free live streaming app on Google Play and the Apple App Store. As always, a huge shout out to the team. Mitch, Bill, and Sean, I love you guys, and to our special advisory committee that can be found at www.scbrtalk.com/advisory committee. Click on the link and learn about the leaders doing the incredible work. Okay, everybody, I am thrilled to introduce Mr. Jarrod B. McNaughton. He is the Chief Executive Officer of Inland Empire Health Plan, also known as IEHP. In this role, he works collaboratively with the IEHP governing board to set the strategic vision and provide executive leadership for one of the 10 largest Medicaid health plans and the largest not-for-profit Medicare, Medicaid public plans in the U.S. He cultivates IEHP's strong partnership with providers, hospitals, and hundreds of community partners to deliver quality, whole-person care to more than 1.5 million members. Mr. McNaughton earned his bachelor's degree from Pacific Union College and a master's degree in business administration from the University of La Verne Graduate School of Business. He is a fellow of the American College of Healthcare Executives. In recognition of his distinguished career and leadership, the healthcare field and the community University of La Verne awarded him the honorary Doctor of Humane Letters degree in 2021. Mr. McNaughton currently serves as the 2024 Board Chair for Local Health Plans of California and Chair of Manifest MedX, the largest health information exchange in California. Thank you so much for being with us today, Jarrod.
Well, thanks, Yvette, for having me. It's great to be with you today, and thanks for offering to invite me to come today, too.
Absolutely. You know, as one of the top 10 Medicare, Medicaid providers in the nation, I'm just absolutely proud to host you today. And as you know, my first question to every one of my guests is to talk about, you know, what motivated you, what inspired you. Give us a brief history and time to your journey in becoming the CEO of IEHP.
Well, you betcha. It's quite a story of that. My family's actually from just north of here. We're Bakersfield kids. Grew up in the Central Valley there at Bakersfield. And I had an incredible mentor among many, whose name was Dr. Darrell Corser, a physician that actually helped to sponsor me to go to school. And I became the first person in my whole family, extended family, to go to get a 4-year college degree. And he just really changed my life and changed the trajectory for where I was going and what I was doing. And I started in the hospital world, taking the first minimum wage job right out of college in a hospital there in the Central Valley, and kind of worked my way up to become a hospital CEO back east at a large academic medical center. And it was during that time there where we were just in really kind of constant legal issues with the IEHP equivalent out there. So no connection at all, but the equivalent back east. And it was a mutual friend at the time, this was probably about 9 years ago, that said, "Hey, have you ever heard of IEHP?" And I said, no, I don't know what that is. And she said, "Well, you really need to call the CEO there at the time, Dr. Brad Gilbert, a physician who was here at IEHP, and she said, "Yeah, you just need to talk to them because they actually have a very unique way in partnering with the provider community that's unlike anything in the United States." And so I cold called him out of the blue and said, "Hey, you don't know me, but I know you through our mutual friend. And I've heard you folks are doing some extraordinary stuff in the Inland Empire with the hospitals and physicians there, and love to learn about how you do what you do." And he had actually invited our entire executive team from back east to come out to the Inland Empire to see this firsthand, of this incredible collaboration that takes place. And we were all blown away. We had never seen any kind of a health plan do this kind of collaboration with providers. In fact, I remember we were looking at each other thinking, can this even be real? And he actually allowed us to take back east on a zip drive all of the presentations, all of the MOUs that were shared, and it allowed us to help reset the relationship with the IHP equivalent back east and really started us on a completely new journey of partnership and collaboration, all because of how IHP does their work with the provider community. And so fast forward a few years after that, my wife and I, who are, of course, both native Californians, said, hey, it's time to get back close to home to be near family. And he cold called me as well and said, hey, we'd love to have you join us here at IHP as our COO. And I said initially, no, I don't think so, Brad, but thank you. I'm actually going to go back into the hospital world. And he said, well, we really want you to consider it. And Yvette, our spouses are so important in the roles that we play. And my wife, who's a critical care nurse, is her background. She said, hey, why don't you try something new? You've been doing this hospital thing for so long. Give it a shot. And if you don't like it, then you can jump back into the hospital world. And I'll tell you, Yvette, it's been the best job I've ever had. And I just have loved to partner and serve the Inland Empire. And it was shortly after I got here, about 6 months after I got here, that Dr. Gilbert shared that he was going to be retiring. And he said, hey, you need to go for this. And once again, I said, no, I'm too new. And it was once again my wife who said, hey, really, you should think about this. And just so grateful that the board gave me this opportunity, because it's just been an incredible way to see a snapshot of what's happening across the Inland Empire with providers and hospitals that are so committed to excellence and serving this community. So pretty wild story of how it all came about.
I think it's an exquisite story, and I love that you were able to, glean from the model of the IEHP on the West Coast to serve your duties on the East Coast. And thank you to your amazing wife for having the foresight and the vision to say, hey, just try something different. And now, fast forward, what it is that you're creating and developing and leading is innovative. It's a model again, and just one of the 10 largest providers in the nation. Hats off to you. So as you were mentioning in your story, you were talking about what made IEHP unique and what makes IEHP unique. Please talk about what, in fact, makes IEHP unique in the landscape of healthcare insurance providers.
Yeah, I'll never forget that when I came to IHP about 9 years ago or so, just for that site visit at the time, no planning at all of ever working here. I remember walking through the hallways and just being in awe of this culture here that was really remarkable around this concept of do the right thing. I mean, I kept hearing that mantra over and over again, that we're the health plan with the heart and we do the right thing. And I heard that over and over again, but I also got to see that in action and actually watching the employee family here doing just that. And so what's so exciting about that is because we are a local plan that was actually created by our two counties. We're kind of a baby, if you will, from Riverside and San Bernardino counties. They helped create us 28 years ago. Because of that connection with our county partners, I think the DNA of doing the right thing for our community is so incredibly ingrained within our being. And you get that sense even still today, whether we're out on hospital visits, whether we're out in the provider community, because we're a not-for-profit local entity, we have no shareholder value. There's no quarterly earnings for stock reports and all that kind of stuff that we have to worry about. All of those dollars stay local, and they get to be recycled, if you will, back into the provider community, which is really, really special. So for me, coming from not-for-profit healthcare, my whole career in either faith-based or not-for-profit community hospitals, where so much of that great work was happening, it's really cool to have now a health plan that has that same kind of real community focus, making sure that the dollars and the resources are staying here in the Inland Empire.
That is remarkable. That is a beautiful model. How amazing would it be for all insurance carriers to adopt that model, whether it's homeowners insurance, right? We are having a devastating impact with homeowners insurance rates, right? Car insurance rates now that we're hearing are going to increase as well. How amazing would it be to have not-for-profit insurance carriers adopt the IEHP model? Just putting it out there. You never know.
That's right.
um,
That's right.
Please talk about your community resources that you offer today through IEHP.
Yeah, it's an incredible, robust catalog of resources that are available to the community. And what's really cool about these resources is that they're actually available to folks who are not even members. So even though we cover about a third of the Inland Empire's population, we cover 1.5 million of the about 4.5 or so million people here. We actually have community wellness centers that are located up in the high desert in Victorville. We have one in Riverside and another one in San Bernardino. And those are actually open to anyone, regardless of whether or not they have IHP coverage or not. Folks can go in and have everything from Zumba classes and yoga classes, incredible cooking demonstrations on how to live healthy through healthy cooking, all kinds of resources connected with our community partners, nonprofit partners that we actually host them inside of our community wellness centers so that it's almost a one-stop shop for folks that are wanting to get back into the job market. Maybe something in life just curtailed them and they now want to get back in there and get a job. We have some incredible community partners that help folks to dress for success, get their resumes in order and together. Folks that might need help with utility payments and whatnot. All of those are under one roof, under our community wellness centers, and it really makes an opportunity for us, again, as a local entity, to not only care for those 1.5 million members that are directly under our care and purview, but also to make it available for the entire community, regardless of whether you have IHP or not. And that's a pretty special thing. So we're really proud of that work that they do out in the community.
I am so overwhelmed by all of the remarkable services. You know, when I was visiting your website and learning more about it, something that really stood out to me was that you view the person as a whole person, right? So physically, emotionally, spiritually, as a whole person and tending to those needs. So this community center is exactly that. Who would have ever thought that a Medicaid, Medicare provider would be creating the space to give these opportunities and prepare folks that want to do more or engage in different ways to do so.
Yeah, it's really remarkable because when you couple that with some of the frontline resources that are happening where we have navigators and community health workers that are actually going out into schools to make sure that students and their parents and families have access to their Medi-Cal benefits. When you look at all of the depth and breadth of the team that's going out to make sure that folks really understand the benefits that are available to them through the Medi-Cal program, it's a very robust catalog of opportunities for folks to not only have their healthcare needs met, but also all of those other areas in life that sometimes can be quite overwhelming. And we're here for them. And that's a pretty special thing for a health plan to do.
Absolutely. Well, I hope everybody listening that is curious, that wants to learn more, makes that trip, visits your website, and does learn more, because these are remarkable resources you don't come across every day. With that said, Jarrod, please talk about what you consider to be some of the more significant challenges currently facing IHP, whether it's, delivering these resources for the community or, making sure that people are coming into your doors. How do you plan to address them during your tenure?
Yeah, it's a great question, Yvette. And in the Inland Empire, we know that it's tough. It's just tough right now in the job market. It's tough with inflationary pressures. There's just a lot going on. And we actually have a saying here at IHP that if it can be done here in the IE, it can be done anywhere in the country. Because when you look at the geographic area that we cover, it's about 27,000 square miles. It's larger than about 10 states on the East Coast. So our region, and of course, one of our counties, San Bernardino County, is the largest geographic county in the United States. Just the geography that we cover is massive. And with that comes some very unique things. We have those folks that are out in the Blythe and Needles and Trona area that are really rural markets that we really try to make sure are supported in the ways that they need support. versus folks that might be in downtown Riverside that have different needs and issues that need to be worked through. And so that's what's so cool, I think, about IHP is that we really try to keep the finger on the pulse of whether you're rural or urban or whatever might be going on, that we're here to support you. For us right now, some of the big obstacles, if you will, that we're really, really paying attention to is, of course, workforce. Workforce challenges are kind of hitting everybody. We're seeing that across the board where employers are just having a tough time finding folks that are actually really able to do some of the work that we have for them to do. So if you go onto our website, you'll see dozens and dozens of jobs at iehp.org. Folks can peruse those job offerings and get a sense that while some of them are entry-level roles, others are really kind of almost just the mastery of skills, if you will, for things like actuarials or financial analysts and whatnot. So the workforce piece is a big concern for us, and we're addressing that, thankfully, through a number of partnerships with local colleges and universities to make sure that pipeline is there in the future, as well as making some really cool benefits available to our current workforce so that they have the opportunity to go back to school and continue their education, and we help to pay for that. The other piece that we're really focused on, Yvette, is around the number of providers that are here in the Inland Empire. As some folks may know, we have the lowest ratio of the provider to population ratio in the state of California. It's actually tied with my home county of Kern County up north, and Imperial County also struggles down to the south with this, with the number of physicians that are available to care for the population that we have. And so because of that, our board did some really revolutionary and innovative things to create two special funds. One is called the Network Expansion Fund, where we actually pay physicians that are here in the Inland Empire who want to recruit a new physician coming in. We'll pay them a very, very healthy stipend to help attract folks, brand new physicians in to hospitals or to physician offices or whatnot. That program has resulted in over 500 new providers in the last 10 years coming into the Inland Empire. That was so successful that our board decided to actually create a new program about 4 years ago. It's called the Healthcare Scholarship Fund, and it's actually a partnership with our three medical schools here in the Inland Empire, Loma Linda, CUSM, which is California University of Science and Medicine, and University of California, Riverside. And we actually offer 50 full-ride medical school scholarships each year to the three medical schools here in the IE. And that has created now a pipeline of about 200 new physicians, as well as nurse practitioners and behavioral health, that will be coming through their programs and then residencies for physicians. And after they complete those programs, they'll have about a 5-year time commitment back here in the Inland Empire. So we're really trying to get innovative on how to address some of those real challenges that sometimes you can't address right today, but you can plant the seeds for tomorrow.
Absolutely. And that takes dedication, perseverance, discipline, and vision to follow these things through. Because as you mentioned, these are not things that happen from one day to the next, but with years of cultivation, you yield a beautiful fruit, which is going to be new treating physicians for the community, and enhancing that workforce pipeline to serve the region in the whole person. That is remarkable. Please talk about the strategies that you implement to enhance your members' satisfaction, in addition to creating and cultivating the environment to produce more healthcare providers. What other strategies do you implement?
Yeah, the whole goal around making sure that our members are satisfied with the care that's being provided to them, it's really one of our very top-notch things that we focus on. That's everything from making sure that we have enough physicians, so we call that network adequacy, that the network of physicians in the Inland Empire across the different regions in the IE is robust enough to care for folks, all the way through to things like our average call time wait time for folks that are actually calling into the plan. We get anywhere from 7,000 to 8,000 calls a day here at IEHP, and wanting to make sure that people never have to wait more than a minute or two for us to answer that phone. And that's important because we know that if folks are in need and they need something, the last thing they want to do is to be put on hold for 30 minutes or an hour or hours at a time to try to get a hold of somebody in an organization to best support them. And I'm very proud that our team has really made a commitment for our member satisfaction and things like our member, what we call member wait time on hold. It's very, very low. Typically, folks are going to get through to a member services rep with literally within just seconds of them dialing the number. And that just makes me so proud. And I've had a chance to put on a headset and sit next to a member service rep as they're taking calls, and just to listen in, to hear about the incredible work that they do to help navigate members in the Inland Empire to the care that they need. And so those are the kinds of things for us, making sure that folks get really connected quickly to the care that they need, get them into those specialists that they need. And a big focus right now is really looking at what could we do in partnership with the providers to be sure that all of the wellness visits are taking place. So this is everything from making sure that kids are vaccinated early on with their childhood immunizations, all the way through to, for those of us that are adults, making sure that we have that preventative care, things like mammograms and colonoscopies, to be sure that we're at the prime health that we can be, and really making sure that the road to get connected to the provider to do that has the least amount of obstacles in the way, that it's as smooth as possible so that our members will actually take advantage of those benefits.
Absolutely, because as we know, preventative healthcare is the key, and it's a matter of getting into that rhythm, into those habits of going, like you said, to get the mammogram, the colonoscopy, the screening for all sorts of diseases, prediabetes, just everything. Please talk about the importance of preventative medicine, lab work, and visiting the physician.
Yeah, it's huge, Yvette. I mean, that is a game changer for folks to be able to really, really pay attention to what your body's trying to tell you. And sometimes you know what it's telling you, and you just want to ignore it. And sometimes you don't know. And that's the beauty of what preventative screenings do, and things like immunizations. So whether it's having an immunization to safeguard you from things that could be out there, all the way through to those preventative measures where it not only is really helping you, but it's also helping your whole family. Because if it's caught early, if something's caught early, it can be a game changer for what you or your family may have to go through in the future. And that's why you'll see billboards out there about IHP to schedule your preventative visit, that we're here to help, to support that, and we'll actually do that with you and make sure you're connected into your provider. So all of those things for us are a way to just be a reminder, if you will, of why that's so important, so that you can have that joy and live a long, healthy life, and so that the burden on your family and friends is as low as possible, so that you're catching stuff as early as possible for you too.
Absolutely, and especially with today's technology, right? A lot of these screening processes and lab work are very non-invasive, yet when things are caught early and detected early, can really mean the difference literally between life and death.
It sure can. I mean, it's amazing what a preventative measure screening can do, that if you catch something in an early stage, it can be a game changer for you. And so that's why we encourage folks, pay attention when your physician or provider or health plan like IHP is recommending. If you get a text from us, if you get a letter in the mail from us saying, hey, we really want to see you get that screening done, there's a reason we're saying that. And that's really for the best good of our members.
Absolutely. Well, we're coming up on a break right now, Jarrod, so let's hold tight. Yvette Walker here with ABC News and Talk, Southern California Business Report, here today with Jarrod McNaughton, the CEO of IEHP, a Medicare Medicaid program that serves 1.5 million members of the Inland Empire community. McNaughton has demonstrated unparalleled expertise and unwavering commitment to improving community health, revolutionizing healthcare delivery in the process. His innovative strategies and dedicated service to the underserved have earned him widespread admiration and respect in the industry. When we return.
Hi, I'm Dana Rademacher with MGR Property Management.
A lot of people wonder about the value that property management has for their property. Property management can include all property types, including residential, commercial, and HOA. It is valuable because property managers are experienced in what can happen at your property. We're aware of liabilities. We're able to do predictive and preventative maintenance. We know what is coming up with the changes in the weather, the seasons, how old certain aspects or different capital projects at your property are. We're able to best negotiate contract pricing, legalities with your tenants, and anything else that you may need to ensure that you're getting the full value of your property.
If you're interested in speaking with the representative at MGR Property Management regarding your property management needs, you can visit our website at mgrrealestate.com, or you can call our number at area code 909-581-6600 to be connected with the representative.
Ontario International Airport is on to a better way to fly with over 65 daily non-stop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
Cal State San Bernardino is home to the only School of Entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
We are the Empire Strikers, the professional sports team of the Inland Empire. We are a fast-actioned and community-inspired pro indoor soccer team. Our mission is to inspire the Empire. Home games, community events, watch parties, and youth camps are all back. Professional indoor soccer is back. Join us and come watch the greatest show on turf at Toyota Arena or on Twitch. Visit www.theempirestrikers.com for more and any information.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
Welcome back, everyone. Yvette Walker with ABC News and Talk, Southern California Business Report, here today with Jarrod McNaughton, the CEO of IEHP, a Medicare Medicaid program that serves 1.5 million members of the Inland Empire community. McNaughton has demonstrated unparalleled expertise and unwavering commitment to improving community health, revolutionizing healthcare delivery in the process. His innovative strategies and dedicated service to the underserved have earned him widespread admiration and respect in the industry. Thank you so much for being with us again here, Jarrod.
Thanks, Yvette. It's been so good to be with you.
Perfect. So prior to the break, we were talking about preventative healthcare and the true game-changing scenarios that provides for those that are on top of their healthcare, getting screened, again, having the mammograms, doing the colonoscopies, really using these non-invasive forms of testing to prevent truly crippling and life-changing scenarios that can result of not undergoing preventative health medicine. So thank you so much for sharing that and for sharing the various mechanisms that IEHP incorporates to prompt its members to remind them, right? It's time for this exam, or we would like to see you come and take these labs or these tests.
Yeah, it's so important to that, and I know folks may get tired sometimes of those reminders when they see them from their healthcare provider or on billboards or commercials or whatnot. But the reason that all of us are doing that so much is that sometimes life just gets away from you. You know, that folks get busy, kids are going back to school, there's just so much activity happening. And you just need a reminder every now and then to make sure to keep yourself first and to make sure you're taking care of yourself. And so that's why we're so adamant and assertive about those.
Absolutely. And, I take all of those recommendations to heart as a mother of three, a working mother of three. You have to be healthy. You have to be whole. And I very much relate it to what we hear when we're on an airplane, right? When we're on an airplane, the stewardess tells us if something were to happen, you make sure you take the oxygen mask, you put it on your face, and you are able to breathe before you help someone else. Mm-hmm. And so the same philosophy, I believe I've adopted it in my own life, and that is I have to make sure I'm healthy, I'm whole, to have the energy, to have the stamina and the health to move forward and be there for my children the way I want to be, right? And I hope everybody that's listening also adopts that mentality, because it's great to be on top of your health. You feel very much more in control, right? And I know there are some fears and some barriers of people that, they don't want to know what the doctor says, but it's a lot more empowering to have those regular checkups and to know and understand how that's positively impacting not only your health, but potentially the health in the future of your loved ones, as you mentioned, Jarrod.
That's right. It's so true. I just, as an example, I just had my colonoscopy done. It was that time, and just the reassurance that, hey, we get that done. You kind of file it away for a few years until they tell you to come back. But it does give you that reassurance that you've done what you needed to do, just to make sure that you're healthy for you and your loved ones that really are somewhat many times counting on you, like you said, Yvette. I mean, hey, if you've got kids or loved ones or parents that are aging that really are counting on you, it's a sure great way to make sure that you're keeping them in the focus.
Absolutely. So, Jarrod, please talk about your vision for the future of IEHP and how you plan to steer the organization towards it.
Yeah, it's a great question, Yvette. We are really excited about our future here at IEHP. Thankfully, we have an incredibly supportive board who, every time we come forward with some innovation and some kind of fun ideas to expand our mission here in the Inland Empire, they're always supportive. And as some folks might know, we actually launched a new line of business this year called Covered California. And it's called IEHP Covered in partnership with Covered California. And this is a way for us to actually really put our toe in the water for the first technically commercial product, where folks actually do pay a premium, or they get special vouchers from the state or federal government to help them pay their premium. And this is through the exchange that was created by the Affordable Care Act several years ago under the Obama administration, that actually allows folks to actually have the opportunity to purchase through kind of almost a group purchasing agent through Covered California, if you will, their own insurance for them and or their family. What we're so excited about with this is that we had projected that we may have maybe 8,000 or 9,000 lives our first year. Well, we're already up over 22,000. And we're not even done with the first year. And so it's really beat all of our projections. And I'm so proud of the team that we're now coming into 2025, open enrollment will be starting here in the fall, just like it always does every fall, for folks that sign up for health insurance, that they know open enrollment well. That will, once it began, be the lowest cost silver plan in the Inland Empire for the second year in a row. And we're actually have the lowest cost increase out of any plan on Covered California out of the entire state of California. And again, I'm just proud of the team for that, because our goal is to keep costs low while making sure access is strong. And it's really a way for us to support those working families that are out there who might make just a little bit too much to be on the Medi-Cal program, but they really want great health coverage. And so that's why we launched that IHP covered product with Covered California. So that's brand new for us, Yvette. We're learning a ton on how to do that. And we really appreciate the community's support on that. And then looking into the future, we're really serious about looking at Medicare Advantage for our senior population. We do have a Medicare Medicaid program called our DSNP program that folks have to qualify for and be eligible for to get that. But for the broader community, for those folks that might be on Social Security, and that's the only form of revenue that comes in every month for them into their household, and they might just make a $50 or $100 too much per month to get onto the DSNP program, we felt like it's time for us to really look at what could we offer for our seniors that are just right on the line, that really need that extra support. And so we're in the middle of that process right now, doing all of the due diligence on what it could look like if we move forward with a Medicare Advantage program here in the next few years. And so we're really excited about that, because now we'll have all the pieces of the puzzle for those folks that really are in need, or what would be considered some of the most vulnerable populations. The seniors would be completely covered either through that DSNP program or through a Medicare Advantage program that's local. You've got the Medi-Cal program, which is that's really what we were founded on. Is first off treating moms and kids. It's blossomed into other things with the expansion, and Covered California. That is really caring for those folks that, again, might be those folks that are working, but they don't get health coverage through their employer, and they really want a good option for their families. And so we're excited because we feel like this would help to make sure that all of the puzzle pieces are in place for the community here in the Inland Empire that may really need it most, that health insurance coverage.
Absolutely. Please talk about the resources and the amenities that exist for those that have questions, that want to learn more, that want to figure out if they qualify, or, under your your new Covered California program as well, if they can move over to that. What resources exist for the community to interface with somebody that can navigate them through that process?
Yeah, the cool thing about this event is there are so many different ways that folks can find out more information on this. Of course, one of the best ways is that if you're tech savvy and you enjoy kind of going at your own pace and looking online, people can jump onto our website at iehp.org. That's iehp.org. And actually see all of those programs and kind of give an overview, if you will, of all of the different offerings that are available. Or folks can actually call us and we can actually go through all of that with them right on the phone. They can just simply call us at 1-800-440-IEHP. That's 1-800-440-IEHP. And if you give us a call, that call will come into our member services line, and they can route you, whether you're interested in enrollment and looking at, am I eligible for those programs? They can get you to the right team for that. Or if you're interested in Covered California or our DSNP program. And so really encourage folks to use this local resource. Again, what's so cool about this event is it was created by our two counties to be local and to be that public entity for as a resource for the members here of the Inland Empire. And so I really encourage folks to jump on our website at iehp.org or call us at that 1-800-440-IEHP for more information.
I absolutely love how accessible your teams are to provide these resources to the community. Thank you so much for that, Jarrod. And so with that said, please talk about your plan to foster further innovation within IHP to meet the evolving healthcare needs of the community.
Yeah, I'm so proud of our team with innovation. In fact, our organization has actually won the state's Department of Healthcare Services Innovation Award more times, double actually, than any other health plan in the state of California. because of the innovative things that we do in pilot projects. And as I had shared kind of at the top of the hour, we have that mantra that if it can be done here in the IE, it can be done anywhere in the country. And we really think it's important to be able to prove that those folks that are in the highest need categories here in the region, both urban or rural, that again, if we can meet those needs and really best support them, that can be duplicated across the state or even across the country. And so whether it's the innovation that's come out of things like using geomapping during fires to find exactly where our members are, and are they on some type of a specialized piece of healthcare equipment that requires electricity, they overlay that information with Southern California mapping technology that shows us where the power outages are going to be. It's just incredible. That partnership actually won an award from Esri, who is located here in the Inland Empire as well, but they serve all over the world. They just gave us an award for that work that we do in partnership with them, all the way through to we've actually had an innovative challenge here where we've invited different organizations and companies from across the United States who are helping to really model how best to reach out to members to meet those quality metrics that we're held accountable to by the state. And we held our very first innovation challenge here on our campus and had a whole host of judges. It was almost like you were on one of the big shows of America's Got Talent or something like that, and Shark Tank, and you had a chance to hear all of these great pitches and ideas. And it was really inspiring event to hear folks, the passion that they have for this work. And again, to have pilot projects to say, hey, this can work and we're going to show it does work. And if it does, then let's duplicate it and let's replicate it. And those are the kinds of things for me that get me so excited, because it's one thing as a health plan to do what we have to do, which is things like make sure our providers get paid. That's really important, to make sure our physicians get paid. But what is so also exciting about this work is to make sure that we're partnering with our providers to do this real innovative stuff that is cutting edge, pilot projects with the state that no other health plans are doing in the state of California. That kind of stuff I get really jazzed about, because we're almost a petri dish for the state of California, and some of the new programs that have been launched over the last several years have actually been thanks to partnerships with the state and IEHP to just show that a hypothesis can or can't work, or we can do a little tweaking here and there and really show that it actually can make a huge difference in the community. So I love that innovation question of it. It gets me really excited.
Oh, I absolutely love it. When you were talking about mapping and overlaying it, I immediately thought of Esri, because as we know, Esri is the world's largest global imaging satellite system that images everything, right? From weather trends to traffic to, like you said, different populations and needs, and being able to incorporate that technology with healthcare or other critical needs throughout the country or the world is absolutely inspiring. And to know that we have a leader right here in our region that is, implementing these technologies and creating opportunities to bring that technology in to better serve the community is an absolute thrill. It's a joy. It's what I live for, to share the stories of, because as we know, best kept secrets like these can not be. They have to be shared and hopefully modeled and established in other places. Just absolutely inspiring, Jarrod. Thank you so much for sharing that.
Oh, you betcha.
Can you talk about any upcoming initiatives or projects that IEHP will be focusing on under your leadership?
Yeah, we're really, in addition to that Medicare Advantage piece that I was sharing with folks, which we're just so excited about, just thrilled to partner more deeply with our providers in the community for some very unique benefits that have been launched through what's called CalAIM. CalAIM is the most transformative initiative that the state of California has ever undertaken in the Medi-Cal program. And it gives folks an opportunity to really have access to some new benefits and new programs and even services that are available now through the Medi-Cal program that includes things that called enhanced care management. These are teams of nurses and behavioral health folks and community health workers that actually can almost provide wraparound services for those members that are in the highest need categories of aid that really have a lot going on in their lives. Maybe they have a couple of different issues, maybe diabetes and heart disease and whatnot. And the team can actually partner with the provider, the physician, and provide these wraparound services to make sure that they are getting to their provider on time during those appointments, making sure that some of those social determinants of health for access to food or housing are help met. In partnership with another new program that the state launched through CalAIM called Community Supports. And that includes things like asthma remediation. In our community, it's a big issue, asthma is, as you know, Yvette. And this new benefit that's available through the CalAIM program actually can help come into a home and actually replace even all the carpet if it's deemed that that's what's causing the asthma problem. Or if somebody has to go into a wheelchair and they need to have door jambs or walls moved to make sure that they can access and use their home, we can actually, for the first time ever, help to pay for some of those kinds of work that can take place. Meals that are medically tailored for folks, we're able to pay for that. So the benefits now that have been increased over the last just literally several months and years are just phenomenal, and really encourage folks to take advantage of those in the Medi-Cal program.
That is phenomenal. Those are services that go above and beyond, I believe, anybody's expectations in terms of what is possible through, caring for a member. And with that said, please talk about how you maintain a balance between meeting the financial objectives of IEHP and still ensuring high quality, accessible healthcare for its members.
Yeah, it's a great question, and one that I'm just so thrilled that because we are a not-for-profit public entity, and we don't have the pressure of shareholder value, we don't have a pressure of stock price issues or quarterly earning reports, that all of those dollars, all of that revenue can actually stay here in the community. It's actually what helped us to create one of the first ever of its kind called the IEHP Foundation. It's a separate entity, a 501c3 nonprofit that actually has an endowment that will now be in perpetuity. And the interest off of that endowment can really do some special projects here in the Inland Empire to help support that whole concept of really having vibrant health and optimal care delivered to the residents of the Inland Empire. So that for us is what's so cool, is that we're able to take those revenues that come in and repurpose them, keep them here locally, supporting our hospitals, supporting our physicians. But to your point, it's something that you always have to make sure you've got the finger on the pulse on, because just because you may be a nonprofit as far as the tax code, you still have to make sure that there's enough dollars coming in to keep the lights on and keep paying the bills. And for us, that stewardship of public funds, because we are a public agency, is incredibly important to make sure that we're sustainable into the future. And right now, we're actually seeing some interesting trends, Yvette, that with utilization going up on services that are being used, we're just making sure that stewardship continues to be really, really strong so that we're sustainable into the future. And that's in close partnership, of course, with our providers. And so it is, to your point, a balance. It's a very, very intricate balance, but one that we pay close attention to just about every day.
Absolutely. But it sounds to me, just based on what I've heard briefly throughout our conversation, that ultimately everything boils down to the philosophy to do the right thing. And this doesn't happen by mistake. It happens by the consistent doing the right thing, consistently doing the right thing, right? And this is absolutely phenomenal. Please talk about the feedback that you get from others in the community that are stakeholders that see what is happening through your innovative vision and, establishing these programs really focused on serving the community.
Yeah, thankfully, because we are local, that connection to our providers and our hospital partners is really second to none. I've had a chance over the last just several days and weeks to go out on hospital visits to visit with our hospital CEOs and the executive teams at our hospitals, just making sure that we always keep them at the forefront of all of the decisions that we're making, and that we're partnering with them on developing new programs and initiatives to care for their patients and our members. And so for me, that keeping the finger on the pulse of the community is absolutely vital, Yvette. I think the minute that you kind of stay in the office too long and you're not getting out and seeing what's happening, I think it's a dangerous thing. Just the other day, I happened to visit one of our homeless encampments here and ran across a woman who was pregnant, and she had not been to see a physician for prenatal care. And I'm so proud of our team that they jumped into action and they actually got her in to see a physician right away. And for me, those moments of when you can get out in the field, visit and connect in with members and patients and hospitals and physicians and others to really hear the true stories of what are going on, I think it brings home the whole reason why we do this. And it's just a heck of a lot of a reminder for me that you really have to make sure the intentionality behind what we do is always putting the member and the physician first.
Absolutely. So, Jarrod, please share what you look forward to as we're actually on the back end of 2024 and finishing off the year briefly.
Yeah, I'm just really looking forward to strengthening our mission more than ever, Yvette, and really just demonstrating to our community our commitment to this region, that we are open to ideas. And I hope folks have gotten a flavor of the innovation that we'd love to hear from folks in the community. Reach out to us. We're a public entity. We're here for you, and would love to make sure people are connected in with the incredible work that's happening here at IEHP.
Thank you so much for being with us today, Jarrod. Such inspiring work. Thank you.
Thanks so much, Yvette, for having me.
All right, everybody listening today, don't forget to look for us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. Don't miss my interview with Letitia Rye Buckley, who is a mom, wife, the daughter of Mexican immigrants, born and raised in East Los Angeles. She has built a career developing programs and guiding public policy that connects the dots between historically under-resourced communities and the arts. Next week, we will have Susan Harrington, president of Communities Lifting Communities. Susan joined the Hospital Association of Southern California, known as HASC, as the executive director for CLC in July 2018, and since February of 2021 serves as president of CLC, an affiliate nonprofit organization of HASC. Susan leads the development of strategic initiatives and projects to advance community health and reduce health inequities across Southern California. Susan develops and manages the CLC organization, staff, and strategic partnerships. Susan earned the Diversity First TM Certified Diversity Executive designation in June of 2022. You do not want to miss it. We will see you all next week.